an increase in suicide rates among U.S. teens occurred at the same time social media use surged, and a new analysis suggests there may be a link. Suicide rates for teens rose between 2010 and 2015 after they had declined for nearly 2 decades, according to data from the Federal Centers for Disease Control and Prevention. Why the rates went up isn't known. The study doesn't answer the question, but it suggests that one factor could be rising social media use. Recent teen suicides have been blamed on cyberbullying, and social media posts depicting perfect lives may be taking a toll on teens' mental health, researchers say. After hours of scrolling through Instagram feeds, I just feel worse about myself because I feel left out, said Caitlin Hardy, a 17-year-old Littleton, Colorado, high school senior who helped organize an offline campaign last month after several local teen suicides. No one posts the bad things they're going through, said Chloe Schilling, also 17, who helped with the campaign, in which hundreds of teens agreed not to use the internet or social media for 1 month. The study's authors looked at CDC suicide reports from 2009 to 15 and results of 2 surveys given to U.S. high school students to measure attitudes, behaviors, and interests. About 500,000 teens ages 13 to 18 were involved. They were asked about use of electronic devices, social media, print media, television, and time spent with friends. Questions about mood included frequency of feeling hopeless and considering or attempting suicide. The researchers didn't examine circumstances surrounding individual suicides. Christine Moutier, Chief Medical Officer at the American Foundation for Suicide Prevention, said the study provides weak evidence for a popular theory and that many factors influence teen suicide. The study was published Tuesday in the journal Clinical Psychological Science. Data highlighted in the study include teens' use of electronic devices including smartphones for at least 5 hours daily more than doubled, from 8% in 2009 to 19% in 2015. These teens were 70% more likely to have suicidal thoughts or actions than those who reported 1 hour of daily use. In 2015, 36% of all teens reported feeling desperately sad or hopeless, or thinking about, planning or attempting suicide, up from 32% in 2009. For girls, the rates were higher, 45% in 2015 versus 40% in 2009. In 2009, 58% of 12th grade girls used social media every day or nearly every day. By 2015, 87% used social media every day or nearly every day. They were 14% more likely to be depressed than those who used social media less frequently.